Hello, good morning, everyone. First of all, thank you to Healthcare for All, a great partner, the trailblazer in healthcare here in Massachusetts, and I'll say throughout the country. I appreciate all the work that you're doing around patient safety, particularly the Consumer Health Quality Council. You know, we are so fortunate here in Massachusetts to have the leading healthcare institutions on the globe. But none of our institutions are immune to patient safety issues, and we know that. The hospital-acquired infection and serious reportable event reports that you're going to be hearing about today are a good start to address patient safety issues here in Massachusetts. And we have a lot to do. That's why I filed a bill that does a number of things. It promotes honest, open communication in the evaluation of care among healthcare providers by addressing systemic and cultural issues that affect patient safety. In the committee, we have over 360 bills. And we took a batch of bills that were relative to patient safety, and we essentially put them together. And we tried working with a number of advocates to see if we can find some common ground to try and get a comprehensive patient safety bill out. And there's a number of those pieces that actually Chairman Moore sponsored in one way or another, so I'm happy that he's here this morning. And the idea is, again, we want to make sure that we limit in the bill itself, we try to limit the admissibility of apologies and admissions of mistakes in cases of unanticipated outcomes. We modify peer review laws to more adequately reflect the current delivery of care across institutions. We extend whistleblower protections to nurses and require the Board of Medicine to train in early disclosure and apologies in its continuing education requirements. We also look to develop evidence-based preventative measures to reduce avoidable errors and other anticipated health outcomes through the use of checklists, screening through procedures that address multi-drug resistant organisms, including MRSA, and study the impact of medication errors and overutilization and defensive medicine on care in Massachusetts. These issues of patient safety and quality become even more important as the dialogue around payment reform move towards basing payment on value and not volume. We need to make sure that we find the right balance so that coordination, efficiency, and quality in healthcare can all be improved in this process. You know, we have to be able to go back to our communities and be able to talk to people about the work that we're doing here in this building. You know, in my community last year, I had a lady whose daughter passed away by a hospital-acquired infection. You know what was the sad thing about it? Is that she never understood what the doctor was saying about the death of her daughter. Never. She didn't speak English fluently. She didn't speak the language of talking to a doctor fluently. And to this day, if it weren't for the help of community-based organizations like Healthcare for All, she wouldn't have at least that closure to actually understand what happened and to ask questions and to engage us as a legislature through me. So the work that we do around patient safety is critically important because, again, we know that even in the greatest institutions here on the globe, we still have issues that we need to work on. So thank you for your commitment and thank you for your hard work.